Good afternoon. It is just so great to be back at IGHNX. I love this conference, and especially this year with this special focus on women's health. I just want to start with the caveat that I was quite a late addition to the programme, so I hope you will forgive me if there are any blips in my talk, but let's see how it goes. The last time I was at this conference, I was here to speak about the rise of conservative or anti-rights movements which have been pushing a regressive agenda on a range of women's health and equity issues. And one of those issues is HIV, which in Africa is the leading cause of death for women of reproductive age, and which has a really disproportionate impact on young women. Every single day around the world, 570 adolescent girls and young women will contract HIV. That will happen to 5 girls in the time that I will be on the stage. And the last time I was here, I also described how these anti-rights movements are campaigning to stop young women in Africa from accessing comprehensive sex education, condoms, and HIV prevention tools like PrEP, which can be real game changers for those girls who are at the highest risk. And I talked about the role of Christian fundamentalist groups from the United States in pushing these campaigns with life and death consequences for women and girls. So I work for Frontline AIDS. It's a global partnership of community organisations who are working together towards our goal of ending AIDS. And on a Friday afternoon in January of this year, we heard the news that the US president had just announced a total freeze on all international aid, including on the president's emergency plan for AIDS relief, which up to that point had provided HIV treatment for 20 million people globally. And very quickly, I started to get messages and calls from partners around the world, and everybody was incredibly worried. And by the end of the week, 27 out of our 54 partners had received letters from the US government telling them to shut down essential HIV services with immediate effect. There was one organisation which is a major provider of services in a country where 1 in 12 adults has HIV, who lost 85% of its funding overnight. And across our partnership, 1.6 million people lost their access to life-saving HIV prevention and treatment. And globally, UNAIDS have warned that as a result of these cuts, 6.3 million extra people will die of AIDS in the next 4 years. I've thrown out a lot of numbers, and they're hard to remember, but one of the things that I remember most vividly from that first week was an organisation in a country where 1 in 5 adults has HIV that provides vital care for women who are survivors of sexual and gender-based violence. You know, things like care for physical wounds, mental health support, emergency contraception, and of course, post-exposure prophylaxis for HIV. And that organisation hadn't had a letter, and the staff were really hopeful that their service must have been protected from the freeze, because they were thinking, well, the work that we do is so critical, maybe we're safe. And I remember just feeling so devastated for them, because I knew that services and programs that were focused on women and girls, in fact, anything that had the word gender in its description, I knew that those services were being deliberately targeted, and I knew that their letter was going to come. And it's really important for me to share that example with you in this space where we're here to talk about women's rights, because we need to know that what has happened to women's access to health services, particularly reproductive health, over the last year is not accidental. In fact, it has been in the planning for years. Back in 2022, an organisation called the Heritage Foundation started to rally its allies across the US. And together, they cooked up a 900-page mandate for the next Republican president, which almost word for word proposes so many of the things that have transpired this year. It is basically a band of middle-aged white guys with a small number of women and people from minorities who have proposed, among other things, the takeover of US aid, which has happened, the removal of all from all US-funded programs of anything relating to gender equality and reproductive health. That has happened. And the narrowing of the very concept of women's rights, away from of women's health, away from the health needs that we all know we have and we understand we have holistically, to a really narrow focus on production of children and raising of families. And a member survey by the International Community of Women Living with HIV has counted the consequences of those decisions. 40% of women surveyed said that they have had to skip or miss their HIV treatment, which for them can be the difference between life and death, because of the US cuts. And 30% of pregnant women were unable to get maternal health care, including care at delivery time, because of these cuts. So what can we do? First of all, we resist. I have a colleague, and her name is Yumna. I wish that she was here today, but she's from South Africa, and it's not easy for her to get here. And, you know, in those first days, we were all so shocked, and Yumna just came forward with this incredible fight-back energy. She was just this beacon of resistance, a fiery beacon, but she was also full of heart and compassion, and she really brought us together, and she enabled us to move forward and cooperate, and also to support one another, emotionally support one another. And you know, that kind of resistance, that feminist leadership is something that can be so easily underestimated by the likes of Project 2025, but actually it is the beating heart of the fight for women's rights. It is the beating heart and the fight for women's health. And another critical thing for us in this time has been hope. I have another colleague, his name is Mitch, and you know, as those letters were coming through, Mitch's job was to pick up the phone and call every single organisation in our partnership. And as he did that, he heard story after story of people who were turning up to get their HIV treatment or other services and finding that clinics were closed. And he spoke to the director of one of our partner organisations. She's truly unparalleled, this woman. She is so dedicated, so inspiring. We call her Dr. P. And she told him about a woman who had turned up that day for her regular treatment, her regular HIV treatment prescription. And that woman, many years ago, had been very, very sick with AIDS-related illness. She had almost died, and she'd seen many people die around her. And because she got that treatment, she got a second chance. And when this woman came in and she heard about the cuts and the fact that the service was forced to close, she cried and cried because she thought that that second chance was gone. She thought that she was going to die. And Dr. P had to hold hope for that woman, and she had to hold it for everyone who was coming into her organisation, which serves over 200,000 people. When Mitch started to do those calls, it came to him quickly that these partners would be stronger together. They would be much more able to cope with the crisis that they were facing, an unprecedented crisis, if they were able to talk and share with one another. So at Frontline AIDS, we started to host, at that time, a weekly Zoom call. And that just created a space for partners to be able to share and learn from and support one another. And in that space, we heard really practical things. We heard about, for example, organisations that were just providing a week of treatment at a time rather than what they would normally do, where it would normally be a much longer prescription. But by doing that, they were able to safeguard the overall stock for everybody who might come in and need it until they knew what the long-term supply was going to look like. We heard people who were looking for financial solutions as well. For example, there was an organisation in West Africa that reached out to all of the local businesses, and they managed to mobilise enough funds, not to plug the entire gap, but to keep the most urgently life-saving services open. And that was a really useful innovation for others to hear about. And in that space, we've heard stories about organisations that have had to lay off almost all of their staff. And we've heard about staff who have been laid off only to return to work the following day as volunteers. You know, can you imagine that? So we have worked together in our partnership and with many other organisations to secure a waiver that would protect HIV services from the US aid cuts. And we secured that for HIV treatment. And in that shared space, we also set our sights on trying to restore US support for HIV prevention. And we have been winning those arguments, despite what Project 2025 might like. And at the same time, we have had to face the fact that we can no longer go along with a situation where life and death treatment for people in Africa or in other parts of the world is dependent on the goodwill of donor governments. We have to have and support more sustainable solutions. And that is one of our key projects in that shared space. So we are working to push for more sustainable financing for the HIV response and for health systems that comes from national governments, and to move towards more inclusive health systems so that that teenage girl who is at very high risk, or that young woman who is doing sex work to survive, she can come into the health service and get her needs met rather than being stigmatized and turned away. We're doing that work through a special project called the Transition Initiative. It's led by two brilliant colleagues of mine called Leora and Claire, and we're really lucky to have the support of the Irish government and Sweden, and we're very grateful for it because it's really important work. And, you know, in that shared space, we also have organisations that are not directly affected by the cuts, but they come in saying, we must act together in solidarity. And that is our Project 2025, and we will keep going because we believe in women's health and we believe in ending AIDS. So why does this matter for our theme of women's health in Europe? Well, anti-rights movements are active right across Europe. We have very well-resourced organisations and campaigns that are actively opposing sex education for young people. We have movements which are hijacking critical conversations about violence against women and trying to tell us that migrants and refugees or our trans sisters are the problem. We have anti-vaxxers who are coming for the life-saving HPV vaccination. We have influencers who are telling young women that contraception is a bad idea. We have the manosphere. So these are all forms of anti-rights mobilization, and we need to be conscious of that and be conscious about when we encounter them, you know, think about them critically and call them out. But also remember that these campaigns are successful because they tap in at the emotional level to people's deepest fears. So if somebody you love is getting sucked in by these movements, try to reach out and connect with them, not through facts, but through feelings. Try to call them back in. We also need leadership at the political level, and that means politicians who are willing to stand up to anti-rights mobilization when sometimes it can be easier for them to collude with it. When Winnie Byanyima took over UNAIDS as the first African woman leader of that institution, she gave a speech where she talked about the concept of true leadership, where politicians decide to do what is right rather than what is popular. And in this space, I want to say that, you know, we have this wider context of the US and other donor countries really cutting back their aid, and yet we have the government of Ireland that has taken a public stand and said that it will protect and speak up for the aid budget. And I think that that is a real example of the kind of true leadership that we need. And I really want to congratulate Ireland for that. And I also want to congratulate the brilliant people in the Humanity First campaign run by the Irish Global Health Network and others. You too have resisted, you too have hoped, and you too have worked together, and you've helped achieve this really brilliant result. Beyond aid, we also need cross-cutting political leadership for women's health and rights. And, you know, we need governments across Europe to be taking a really strong stand on these issues with firm principles, courageous policies, and strong financial investments. And by doing that, Europe can be a counterweight to what is coming from the US. In 2004, when Ireland last had the EU presidency, it convened European leaders around the Dublin Declaration on AIDS. And that was really important in catalysing EU-wide leadership on the AIDS crisis, which really at that time was at serious crisis levels. And Ireland has an EU presidency coming up again, as many of you will know. And I think that that is a real opportunity for Ireland to step out and take that lead again and catalyse real action on these issues, which are the new crises of our time. I'm almost done. I think I'm way past my time. I've only just seen the timer, but this is my last one, I promise. Earlier, my fellow Fionnuala, and I am equally excited and delighted that there are 3 Fionnualas here today, as is my son, who did tell me not to mention him, but I can't quite help it, he's in the audience. You know, Fionnuala shared that wonderful collective Irish experience of receiving sex education from a nun, and the beginning and end of that sex education being, just don't do it. And, you know, as Irish women, we have seen unprecedented transformation on our health and our rights over the last generation. And so we know where the likes of Project 2025 want to take us, because we have only just come from there. And we are not going back. So I want to finish by saying, let's make it our project to protect what's been achieved for women's health, whether that's for women with HIV in Africa, or whether that's for us, our mums, our sisters, our daughters, our friends here in Ireland. And let's persuade our governments and governments all across Europe to fight for the future of women's health. Thank you.